Did you know that up to 70% of men under 40 who struggle with erections aren't dealing with a physical breakdown at all? It's their mind playing tricks on them? Imagine gearing up for an intimate moment, only to have your thoughts sabotage everything before it even starts. And what about those frustrating mornings when your urine stream decides to go rogue, splitting in two directions like it's got a mind of its own? These aren't just random annoyances, they could be subtle signals from your body that something needs attention. Gentlemen, if you've ever felt that pang of worry comparing yourself to what you see in adult films, wondering if you're measuring up, you're in good company. Today, we're peeling back the layers on these hidden concerns that so many guys face but rarely discuss. We'll explore why your brain can hijack your body's natural responses during sex, the real story behind those exaggerated on-screen appearances, and what a split stream might reveal about your prostate health. By the end, you'll walk away with simple, actionable steps to regain control and boost your confidence. Let's start with something that hits close to home for a lot of men: losing an erection because your mind won't quiet down. It's not about lacking desire or having a faulty system, it's often a temporary glitch triggered by stress or overthinking. Picture this: you're in the moment, everything feels right, but suddenly a stray thought creeps in: what if I can't keep this going? And just like that, the spark fades. This is what experts call psychogenic erectile dysfunction, and it's more common than you might think. Studies from places like the Journal of Sexual Medicine show that in younger men, psychological factors account for the majority of these issues, sometimes as high as 80 to 90% in guys without underlying health problems. It's like your nervous system has two gears, one for relaxation and arousal, and another for alert mode. When anxiety kicks in, it flips the switch to survival instincts, redirecting blood away from where you need it most. Have you ever noticed how a simple worry can make your heart race or your palms sweat? That's the same sympathetic nervous system at work, prioritizing fight or flight over rest and digest. In evolutionary terms, it makes sense. Back in caveman days, you didn't want to be vulnerable during a threat. But in modern life, that threat is often just in our heads, like performance pressure or past letdowns. Let me share a relatable scenario to illustrate this. Think of a guy named Mike, in his mid-30s, who's been with his partner for years. One stressful week at work leads to a fluke moment in bed, and suddenly he's replaying it over and over. The next time, he's so focused on not failing that his body tenses up, and the cycle repeats. I've heard stories like this from countless men. It's not rare, and it's not irreversible. To break free, start by shifting your mindset. Instead of aiming for perfection, focus on the connection. Try building intimacy through non-penetrative activities first, things like mutual massages or exploring each other's senses without the end goal in sight. This rebuilds trust in your body step by step. Research from cognitive behavioral therapy trials backs this up. Techniques like mindfulness can reduce anxiety by 50% or more in just a few weeks. Another analogy: treat it like learning to drive. At first, you're hyper-aware of every pedal and mirror, but with practice, it becomes second nature. Incorporate deep breathing exercises before intimacy. Inhale for 4 counts, hold for 4, exhale for 4. This activates that relaxing parasympathetic response, helping your body stay in the right mode. And if you're wondering about medical support, a quick chat with your doctor can rule out any physical culprits like hormone imbalances or early vascular issues. Sometimes, a low-dose medication like tadalafil acts as a temporary bridge, giving you the confidence to retrain your responses without creating dependency. The key is patience. Most men see improvements within a month of consistent effort. But here's the part most people overlook: lifestyle plays a huge role too. Regular exercise, like 30 minutes of brisk walking daily, boosts circulation and endorphins, which naturally combat anxiety. One study from Harvard found that men who stayed active had 30% fewer erection issues, even as they aged. Pair that with better sleep. Aim for 7 to 8 hours, because fatigue amplifies overthinking. What do you think about trying a journaling habit to offload those worries? Write down 3 positive things about your body each night. It rewires your brain toward gratitude instead of doubt. Small changes like these add up, turning a vicious cycle into a virtuous one. Now, shifting gears to another big myth that trips up so many guys, the idea that porn stars represent some unattainable standard of size and stamina. It's easy to scroll through content and feel inadequate, but let's unpack the truth. Most of what you see is smoke and mirrors, not everyday biology. The average erect length worldwide, based on global studies involving thousands of men, hovers around 5.1 to 5.5 inches. That's the norm for 95% of us, yet adult films cherry-pick performers who are outliers, often 7 inches or more. It's like watching professional basketball and wondering why you're not dunking like LeBron. They're selected for extremes. Add in production tricks, close-up camera angles that distort proportions, strategic lighting to enhance shadows, and even post-editing to amplify visuals. Some scenes use body doubles or props subtly. And yes, medical aids come into play. Vacuum pumps create temporary swelling for girth, while extenders worn offset might add a fraction over months, though results vary and aren't dramatic. Medications like sildenafil help with endurance during long shoots, but they're not magic enlargers. In extreme cases, some opt for fillers, injectable substances that add temporary volume, but these carry risks like unevenness or complications. Penile implants? Rare, and they're more for severe ED than size boosts. They allow mechanical inflation but don't change natural dimensions. Emotionally, this comparison game can erode self-worth, leading to avoidance or strained relationships. But remember, satisfaction in real life stems from technique, communication, and emotional bonds, not measurements. Surveys from women's health journals consistently show that emotional connection ranks higher than size for fulfillment. Picture this story: a patient of mine, let's call him Tom, spent years fixated on what he saw online, convinced it defined his value. After we talked through the realities and he focused on overall fitness, weight training for better testosterone, Kegel exercises for stronger control, his confidence soared. He realized his partner cared more about presence than perfection. If size concerns linger, safe options exist. Traction devices, used 4 to 6 hours daily under medical guidance, can yield modest gains of 0.5 to 1 inch over 6 months, per studies in the British Journal of Urology. But surgery? I advise against it for cosmetic reasons. Risks include scarring or reduced sensation. Instead, prioritize what boosts natural performance: a diet rich in zinc and omega-3s for hormone health, like nuts and fish. Have you experienced that nagging doubt from media influences? It's universal, but shedding it starts with education. Focus on what you can control: stamina through cardio, energy via balanced meals, and watch how it transforms your mindset. If you're enjoying these insights and want more ways to enhance your vitality naturally, don't forget to subscribe and join our community of guys taking charge of their health. It means the world to see you here. But this next one might surprise you. Ever had that awkward bathroom moment where your stream forks unexpectedly, making a mess everywhere? It's not just clumsy aim, it could point to something worth noting about your urinary system. Biologically, the urethra acts like a flexible tube. If there's any residue, say, from recent ejaculation or even morning mucus, it can partially obstruct the opening, causing the flow to split. This is harmless and temporary for most, clearing up after 1 or 2 trips to the bathroom. But if it's persistent, it might signal benign prostatic hyperplasia, or BPH, where the prostate enlarges with age, pressing on the urethra. Think of the prostate as a walnut-sized gland surrounding that tube. As men hit 40 and beyond, it can grow due to hormonal shifts, leading to weaker streams, hesitation, or dribbling. Studies estimate 50% of men over 50 deal with BPH symptoms, but many dismiss it as just getting older. Ignoring it, though, can lead to discomfort or even infections. Urethral strictures, scarring from past injuries or infections, are another culprit, narrowing the passage like a kinked hose. Emotionally, this can feel embarrassing, prompting guys to avoid public restrooms or joke it off. But practically, tracking patterns helps. Note if you wake up multiple times at night to go, or if the flow feels strained. Let me paint a picture with a real-life example. Consider John, a 55-year-old who laughed off his split streams until frequent urges disrupted his sleep. A simple check revealed mild BPH, and with lifestyle tweaks like cutting caffeine after noon, he regained comfort. Early intervention is key. Untreated, it can strain the bladder. For fixes, start simple. Sit while urinating to relax muscles and ensure full emptying. Hydrate well, but space it out to avoid overload. Foods like tomatoes and berries, packed with lycopene, support prostate health per research from the American Journal of Clinical Nutrition. Supplements with saw palmetto have shown in trials to ease symptoms by reducing inflammation. Always check with your doc first. If symptoms ramp up, a urologist can assess with non-invasive tests like flow rate measurements. Treatments range from alpha blockers to relax muscles, to minimally invasive procedures if needed. The goal? Restore ease and prevent escalation. Tying it all together, whether it's calming your mind for better erections, ditching unrealistic comparisons, or addressing urinary quirks, empowerment comes from action. Boost testosterone naturally with strength training twice a week, improve stamina by managing stress through meditation apps, and restore performance with consistent check-ins on your habits. Men over 50, especially, can increase energy by prioritizing sleep and nutrient-dense meals. Think lean proteins and veggies. These aren't overnight miracles, but they build lasting change. You're capable of more than you realize. Your body responds to care. Where are you chatting from? Drop it in the comments section. And if this has sparked some hope for your own journey, hit that subscribe button for more practical tips on men's health and vitality. This is Dr. Alex from The Healthy Body, here to guide you toward feeling your best. Thanks for watching. Take that first step today.